Conference on Injury Prevention, Sri Lanka 2023. This plenary session will be focusing on injuries and climate change. The theme of the session will be tackling the dual threat, injuries and climate change in the spotlight. The chairpersons for this session will be Professor Srima Premkumar, Chairman, Industrial Technology Institute, and Mr. Chakula Dianarachi, Director, Disaster Preparedness, Disaster Management Center. I cordially invite our chairpersons to the stage. Over to you, sir.
Thank you. Good evening to all of you. Let me welcome all of you to the final session of today's conference. We have three speakers for this session on injuries and climate change. Dr. Anand, Mrs. Chandana Kalupahana, and Dr. Chandana. So without taking much time, since you are behind the schedule, let me introduce the first speaker, Dr. Anand Malvatantri. Dr. Anand Malvatantri is an experienced Sri Lankan professional in project management, multi-sector and multi-stakeholder partnerships, research, education, and sustainable development. The BSc in Chemistry and Diploma in Business Administration. Anand's academic journey led to a MSc in Environmental Science and a PhD in Soil Physics from Washington State University, USA, as a Fulbright scholar. Dr. Anand Malvatantri has held notable positions at prestigious organizations such as USA, serving as a senior advisor in environment and energy, and country director for USA, US Asia Environment Partnership Program in Sri Lanka, and UNDP Sri Lanka as assistant resident representative and team leader for environment, energy, and disaster risk management in Sri Lanka. He also contributed as country representative for IUCN Sri Lanka. After 20 years in international development, Dr. Malvatantri presently serves as the advisor to the President of Sri Lanka on environment, climate change, and green finance. Dr. Anand Malvatantri actively engages in voluntary contribution with private, public, and community agencies and has earned prestigious awards in research, disaster management, energy, environmental, and corporate sustainability initiatives. Over to you, Dr. Anand.
Good evening. Thank you, co-chairs, ladies and gentlemen. Due to the time constraint, I requested not to read that over, but somehow you will get that message. I don't like two things. One is the long introductions and the other one is classes. So I think I saw class is also hanging around. So please kindly don't present it to me. So basically, what I am going to do is to talk to this distinguished audience about the subject close to our heart, but directly and indirectly related to the subject of medicine. What I will do is I will probably walk you through very quickly on the climate change impact, and a little bit about the global and local context, and also will take you a little bit on the spatial distributions. Sidhu had a wonderful database presented. Probably you might see some of the linkages with those information. And then risk reduction approaches, I see a lot of risk reduction approaches on the back. I will probably touch on some of them, and I want to highlight something. What is the need for multi-sector, multi-stakeholder approaches in this injury prevention? Because it's complex. With that caveat, basically climate change, as you know, affects everybody. It's big time and it's the top of the town these days. In health, the main thing is the temperature increase and then associated repercussions, and in the precipitation changes, the frequency, the duration, and the intensities, and the sea level rise. So these leads to different impacts on the different sectors, and in health we have infectious diseases taking different shapes and forms, and many other things we will see. Generally we see most of the climate things are ecosystem connected. You take Asia, it's mostly floods, and there is some significant droughts and waters, and then globally also the same. When it comes to the events, we call them hazards, and then hazards, the climate, there are things that we could do adaptation. We could do certain things to adapt to the impacts, and then certain things we need the drastic risk reduction measures that are very event specific and things like that. There are a lot of literature on these things, how to get into that. But I have your attention on one area. To look at the predictions into the future. You see this red bars. That's the one going to change in the near future, which is the temperature. And it is very close to your heart because all the diseases, most of the diseases are connected with temperature, one or the other, the old vector ones, and then the viruses and pathogens. So the prediction is that it's going to get increased. You see some of the development features. So the injuries, I think you know the definitions, I'm going to touch on that. But injuries, the last bullet, injuries will take our quality of life down. It will slow down the national efforts to recover out of the present economic things and the future. And then most of the important part is injuries will take out, so there's opportunity cost. Nationally, if you spend more on one area, you have to cut down on some other areas. So, especially the education. And there it's, and we see, I was told last night, the rate of amputations by diabetes type 2 is on the rise. So you can see health cost and the investment on health has gone down and the prevention has suffered. So you have this kind of repercussions coming in. When we take the disaster, it is probably tells all you need to know about the disasters and the effects. The droughts, landslides, cyclones, sea level rise, floods, and then things like the events, conflicts, and then there are much in the lower level. They are sort of pollution related but have certain injuries that are not apparent, but they are equivalent to the fall downs and other things. So you don't know actually the impacts. The sediments, one example. In chemistry, sediments can carry a lot of pollutants into the food chain. So the pesticide applied in your area can harm to another area and then slowly come back to you because they are not being removed. Sediments are being removed, but sometimes it's get released. Microplastics, same. The microplastics can carry things through to the food cycle. Then you see all kind of problems, and you know much more than us bring that spatial domain so that we could do the analysis data. This is a disseminator data. Mr. Chatur is very familiar and is from the research management center. This is data. Which was started about 2 years ago. And you can see the droughts, where the droughts are. These are 20 years summaries and where the plants are, where the landslides are. So the preparatory measures and things like that can go, and you can do a lot of planning and a lot of sort of yearly reductions also along with that. The climate. This is the Sri Lankan story of climate. The last 30 years of data, you see in the left and right corner, you can see the warm nights have increased, cold nights have gone down, total precipitation has gone up in certain areas, and most importantly, precipitation intensities have gone up significantly in some areas. The lower set is a prediction the next 100 years. Wet areas will have more rain, dry areas are going to get drier and hotter and hotter. So the Kalupahana is on the temperature. You can see it's going to happen to us. If the business as usual practice continues, unless we do something now, you can curtail. And there are so many things we can do. And then summary of that is the thermal humidity index that probably are familiar. I would like you to focus on that thermal humidity index and the top one on the right hand corner. That is on day. When you have the temperature increasing and the relative humidity increasing, this is the kind of scenario. At the end, animals won't eat, then at the end, they will pass away. So this is probably mimic what's going to happen to humans as well as to the biota. So this is all ChatGPT. So you can see tons of material and the things to do is just ChatGPT at the generate table. Just case study. So that means you have a lot of information on the internet that you could use. Coming back to Sri Lanka, this is ground level data. This data this year, UNDP released. You can see the vulnerabilities, where they are, and then the provinces. This report can be downloaded, and you can see this gives a lot of ideas, and some of these ideas can be tied up to the medical aspects, as education ones, food, water, all these vulnerabilities. So I think this is a good report that will tie up with the injuries and many other things. And when it comes to the geographic in Sri Lanka, we want to mainstream the reductions of the injuries. You have the roads, you have jungles, you have the water bodies, all that are available for us to plan, and then mainstream these principles of risk reduction into the picture. This is the pollution. These are the primary pollution: agriculture, industry, urban, and others. And if you take water, these are the inputs: E. coli, chemical demand, turbidity. I think all these are familiar to you, but you could work on these and educate people. And this chart was the chart used to educate citizen science. Take to a community and say your E. coli is higher, they will take you to where the vehicle levels are. You come and say metal is higher, they will take you to the vehicle or the factory or wherever they think that the metal is coming from. So these are very useful prevention information. Same with the plastics. Different type of plastics, different color plastics, you could measure and do a lot of citizen science. So as I said in the beginning, this whole thing is a complex subject. It is interwoven risk reduction and climate change. So we need to do a lot of risk assessments to see the spatial and the temporal variations, and the main aspect ties up with this is the governance schemes. Sri Lanka, we have failed in number of years in governance. So we have to come back and then get information driven scientific governance systems, so that way we could strengthen the finance. because right now it's very difficult to apply good finance on these subjects unless you come up with a good governance systems. And then one thought is that most of the strategies can be stopped with conservation measures, we call them nature-based solutions, especially the urban greening and cooling. That's one area coming forward nicely because you could reduce the air conditioning loads and save tons of money, but at the same time, there were a lot of studies done on buildings and the comfortness and then the disease and a lot of hibernation problems were identified in urban areas with the temperature increases inside the houses. So those are also part of the injuries. So in conclusion, I like to take your attention to some areas that might want to think of the future. Can work on the climate smart ecosystem sensitive disaster management that could prevent injuries. That also true for urban settings and rural settings. All those needs public-private partnerships because no single entity can deal with these kind of subjects. So the good investments, now one example, there are a lot of material now coming to every parts, every people. That's totally funded in the world globally by insurance companies. Because for them, preventing one step can save money. So globally, lot of steps. So what we try to do is to get people outdoors, walk people, get out the people, and they invest on programs like the range of programs and the lot of material in there, and it is widely in Canada. It started in Australia, now it's in LA and California everywhere. So then the capacity building, the swimming training, the state search and rescue preparedness, because we hear a lot of problems, a lot of accidents, just because we are not prepared, our balance is low. Then coordination and management, we heard several presentations earlier, and also this presentation about the ethics, just very good. And then periodic review of injury prevention preparedness. I think Mr. Chandana, I remember you were really training in Japan on these camps. Japan has these camps. You train first. You go to Poland, set up a camp, and then you train CPR, and then you train people on these knots. It is in the back of this ambulance, and all that. If they just take any public gathering, they have these things. So I think we could do a lot of those in Sri Lanka as well. And then take advantage of global knowledge. A lot of risk reduction measures that we could use in Sri Lanka. And if you can save money on the injuries, that money can be used somewhere else. That's the key. Thank you so much. Thanks for listening. Share. Thanks.
Very much.